Sandra is a dermatology nurse and project lead for Eczema Outreach Support, a charity supporting children, young people and their families with eczema. She is past chair of the British Dermatological Nursing Group and a specialist advisor for the CQC. Sandra became a Queen's Nurse in 2007, Fellow of Queen's Nurse for Leadership in 2012, and was awarded an OBE in 2015. Sandra's session will cover patients' physical and psychological needs surrounding hygiene, support carers can provide, evidence, and key principles.
Thank you very much. Thank you for inviting me to join this session today. I hopefully can give you some dermatology skills and practical tips when caring for patients requiring skin hygiene. So I'm going to discuss the underlying principles and procedure for bed bathing. I'm not going to go into in depth about bed bathing because probably many of our audience have done many bed baths over the years. But I think it's important to give you some tips around dermatology and skincare. So the aims of the session, I can just go on to the next slide, bear with me, are to look at how the hygiene needs of patients in hospitals and the community can be met, how we can support patients in maintaining their personal hygiene, how does skin hygiene and bed bathing help with our self-esteem, evidence around the practice of bed bathing and the key principles. And obviously I'll allude to practical information and guide, examples from my clinical practice of many years of dermatology. Okay. So personal hygiene is important for skin health and maintaining self-esteem and quality of life. And we see there's been quite a lot on social media and in the media in general about, and I've shown you a couple of examples of where there's descriptions of poor care in hospitals and care homes, delays in waiting to be seen and assessed in urgent care departments and on wards. And these are just a few examples I took from social media to show you that. And it's important that, we are there to support our patients and advocate for our patients. So I'm going to talk about the practical aspects of good patient hygiene, as I already said, allude to skin health and the psychological aspects of caring for somebody that needs personal hygiene support and input. So the practical aspects of providing good hygiene. I think it's important when you're addressing the hygiene needs of patients to consider so many aspects. As a dermatology nurse, there's just an array, isn't there, of products. If you go into the supermarket these days, there's a wash product for everything. And it's important that you're mindful of what patients are using, how they use the products and their concerns about products and possibly allergy, because we all like certain products, don't we? And nowadays I specialise, as well as paediatric eczema, I specialise in female genital skin problems. And you've only got to look at the supermarket shelves now, and there's a feminine thing for everything now. And patients get confused about what they should use and how they should use them. And they may have different products for different body sites. And there's a real drive, isn't there, around shaving as well on all body sites. Other things you need to consider, and I see quite a lot in all age groups, but I'm seeing quite a lot in my paediatric atopic eczema workload, is that people with disabilities or neurodiverse conditions often struggle with using products, wash products, because of the texture, the smell, the packaging it comes in. So you need to be mindful of those. And as I've already alluded to, there are so many products out there, and there's a wipes for everything now, isn't there? And you've only got to look at the problems that wipes cause from an ecological point of view as well. From fat bugs in sewers in London and etc., where everything gets built up and they get flushed down the toilet, and the potential for all these products to cause allergy or irritate the skin can't be underestimated. So ask about what they're using and how they're using it. And a lot of people think that if they can't use certain products, if they buy something that's baby, it's fine. But any product you use on the skin potentially could cause an allergy or irritate. So it's finding what suits your individual patient or their needs. And say, ask about what they've been using. The picture in the middle with all those various creams and tubes was a lady that I did a home visit on once with her genital skin problem, and they were all being used in the genital skin area because nobody had evaluated and reviewed her repeat prescriptions. And that's an important thing to ask about when you're caring for patients, and ask their families what products are they using. And that's not only what they're prescribed, but also what they're buying over the internet. And as nurses, we play a fundamental part in supporting patients with their hygiene. We provide role models around hand washing and good hygiene measures. And it's important that you focus, as Tamara said, on the wishes of the patient, their routine, and what their expectations are. And it should be it shouldn't be a task. It should be an interactive, enjoyable experience, both for the nurses and the patients, to improve the quality of their care. So by allowing patients to participate in their care, it does encourage independence and dignity. It enhances the relationship, yes. It allows you to provide a comprehensive assessment of the patient, particularly focusing on the skin, as well as providing the personal hygiene and bed bathing. It plays a significant role in self-esteem. And it's important that you assess the skin. So many times we hear patients who say, oh, nobody's ever looked at my skin in that way before. If you're admitting a patient or caring for a patient, you're going to be doing risk assessments around pressure damage, but you'll also identify other underlying skin problems that the patient may not have told you about or highlighted because they're conscious about how they look or embarrassed to mention that they may have a skin problem. So traditionally, bed baths have been a fundamental part of our nursing, and I've been nursing many years, and we all remember that in our nurse training. And traditionally, soap and water was the method used. However, soaps can be very dry and uncomfortable and not always well tolerated. And there are lots of alternatives available now. As I've already mentioned, there's wipes. The eco mist that some of my colleagues are going to mention to you later are new ways of looking at how we can cleanse our patient's skin. We need to make patients comfortable. We need to ensure that we minimize the risk of infection. We need to be time efficient because as nurses, we're very, there's a lot of pressure on us to get through our workloads. And obviously there's expenditure costs around laundry, use of products, etc. So when you're looking at the skin, it should be considered as one entity. And I don't know about some of you who's joined the webinar today, but when I started in nursing, you only had the basic fundamentals of what the skin was and functions. Well, having been in dermatology for a number of years, the skin tells a great story about not only the physical signs, but the psychological impact of the skin condition and underlying skin conditions. So it's important you understand what you're looking at. And skin assessment, that's probably another session for another day. But it's important you look at things that impact on skin health. So social circumstances. And at the moment, with the cost of heating, electricity bills, water, etc., for many patients, young and old, or families caring for somebody that has a skin condition, there are things you have to consider is the finance of being able to bathe or shower regularly, washing their clothing and their bedding, because obviously they're using products that can affect their laundry. Some people overwash because they're conscious of their skin condition, so that can cause skin damage. Or there may be the extremes where there's lack of hygiene, so there's a risk of infection. And neglect and inability to actually self-care is important. Poor nutrition and hygiene, again, can impact on skin integrity. And it's important to be mindful of that, especially with patients that have a low budget, have people maybe neurodiverse. Quite a lot of my pediatric population don't eat a lot of iron-rich foods, often eat beige foods. And if you're iron deficient, that can make your skin itchy and very dry. As you get older, obviously the aging skin changes in frailty. It's more susceptible to damage. And then the mental health issues around, as Tamara mentioned, around dementia, depression, etc., impacts on skin health and the ability to self-care because of those issues. Incontinence is a huge issue. And in my genital skin clinics, I used to see a lot of women try and hide the problem with their continence issues because they're anxious about telling people that they've got a continence issue, when there's really good, excellent help out there, but it's that embarrassment of that stigma of telling somebody that you have a continence problem. So again, I've seen many women use products to try and, wipes. I'll slip it in here now, but Sudocrem is a product that's been around for years, and it's a swear word in my vocabulary because it has the potential to cause allergy, but I saw that commonly used a lot in women that had continence problems or genital skin problems because they used to hide the fact that they had problems in that area. And obviously, medical interventions may impact on skin health, and they may already have an underlying skin condition, may have wounds, they may have skin damage, and I've said underlying conditions. And that polypharmacy, what else are they using? Like that lady with that slide with all those images. I think it's also important to recognise that we recognise that skin presentation and clinical signs differ in skin of colour. And I've put a link there to some excellent resources that shows you different skin conditions in different skin types, which is really important because in a white skin, inflammation and redness is clear, but in a skin of colour, it may be purple, dusky or grey. So it's important you're aware of that. The use of emollients or skin moisturisers for patients with skin conditions is common. There isn't going to be a practical session this afternoon. This presentation was done when it was going to be a face-to-face session. But it's important you're aware of what emollients patients are using, how they're using them, and there's safety issues around using emollients. So I often see patients double dipping and putting their hands in pots of creams, and we know that pots of creams are a good source of bacteria. And a colleague in Sheffield swabbed pots of emollient and grew Staph aureus, strep, MRSA. So check what people are doing with their pots of cream. We don't advocate bath oils for washing now. There's no evidence base that they work. So an emollient that you can use as a wash product is really important. There has been a lot of work around emollients and fire risk. At one stage, we used to advise that emollients that contain a paraffin base were increased risk of flammability, but it's for all emollients. My colleague in Lincoln has done some work with looking at ignition and burn time in bandages and fabrics which were impregnated with emollients, had been washed, but was still very flammable. So check out if if it's a care home or a home visit or something where the patients are having candles or diffusers, there's a real risk of ignition. That shouldn't stop patients using their emollients, but it's important to be mindful of that. And also, as I've alluded to, check what people are buying over the internet and online. These are some examples of in my clinical practice. So the Etienne product was a family who had been supplied this from a market stall in Birmingham that contained a potent steroid. The top one, the Order, was another product that a family were anxious about using topical steroids. And they had a friend that was a lorry driver that went over to one of the Eastern European countries, I can't remember which one, and he was bringing back this wonderful magic cream that was brilliant. However, when I did a search of the MHRA or the European equivalent, it was found to contain a potent steroid. The bottom one was another family that were anxious about using topical steroids, and there's lots of misinformation around steroid use at the moment, and they were anxious about using steroids. So they bought this lovely natural, as you can see, lemon vape cream, which actually contains Dermavate, so a super potent steroid, and that was purchased in a hair and beauty salon in Sheffield market stall. And then the two on the right were other purchases of Dermavate, so super potent steroid, from eBay. So if you suspect that people are using what's deemed as natural products, check out their ingredients and report to the MHRA if you suspect they contain potent therapies. The lemon vape one, interestingly, recently I looked on eBay again because I was doing a paper, and they were marketing it as a skin lightening cream, because if you put steroids on normal skin, it will cause lightening of the skin. So be mindful of that, and you'll all be going on eBay later to have a look, won't you? But ask those questions, and also monitor what if patients are prescribed treatments, monitor their use and how much they're using. Because unfortunately in this economic climate, I see lots of people selling their unused prescriptions, such as their emollients, on all these pre-loved selling sites, eBay and even Amazon, because if you get free prescriptions and you stock up on your products, people are selling them, and at car boots, etc. Then you need to look at the psychological aspect of caring for your skin. Now, this picture on the right is a when I started my dermatology career in Nottingham many years ago, we used to have patients on our wards for a number of weeks with their inflammatory skin conditions. And I was the first nurse to go out and do home visits. And I remember vividly, we had this gentleman that regularly came in for his psoriasis. And when we asked him about bathing and put a plan in place for him when he went home, he agreed with the plan we put in place. But it was only when I went home to his home that we found that he didn't have a bath, but he used to go down to these public baths in Nottingham to have his bath. But because he had a skin condition, they wouldn't let him in to the end of the day. And of course, then there was no hot water. So don't assume that everybody's got a bath. Everybody can adjust to the treatment plan you may be initiating when they're in a caring environment. Delve a bit deeper and don't assume that we can all accommodate that. So as I've already alluded to, it's important to listen to their values and what they do. Look at what time of day they may prefer to bath or shower. And for some, we get asked commonly with patients with a skin condition, how often should I bathe or shower? And there isn't any strong evidence base around that, although for the children with eczema, there is going to be some studies there is a study looking at that at the moment. It's finding what that individual patient or their carers prefer to do and find enjoyable. Obviously, you need to look at religious and cultural issues because of gender issues and prayer. And as already alluded to, what they're being prescribed or purchased by family members. So the key principles of bed bathing are keeping the patient warm, which is Tamara alluded to. Make sure you have all the equipment, the linen skip and everything immediately, so you're not carrying linen, dead skin cells, etc. around the environment, because if you've got somebody with a very dry skin condition, there will be a lot of dead skin in the environment. Only expose the area of the body that's been washed. Change the water if it becomes contaminated or cold, especially if you're washing the genital and the sacral area, and change your cloths, etc. when you're washing those private areas. As part of your assessment, you're going to be checking for pressure damage, and also it's important to check in the skin folds as well, because again, a lot of patients with continence issues or skin conditions often have inflammation or underlying problems in the skin folds, or it's called intertrigo. So make sure that they're using products and they're washing and drying properly. Obviously, you've got to look at your manual handling and use of equipment, and remember to talk to your patients and not over them, as Tamara alluded to. I'm not going to go into the details of this because this is on the slide. This is from the article that on bed bathing. It's important to be, systematic in your routine. Check and work. Include the hair and in the flexures, behind the ears. Check the nails between the finger webs, because you will pick up on underlying skin conditions, nail damage, etc. So be systematic. Because think about shaving, hair washing, etc. And this continues onto the bed bathing, and I say it's just to summarise it all. And obviously change the bedding and the sheets, etc. So really, I think it's important to consider, do we follow the tradition of how we were used to bed bath, or do we look at other ways of providing personal hygiene? And I just want you to, there's a paper that's in the references, and you need to, in this day of economics and time, consider the costs of laundry products, wash products, etc. It's important to consider your infection control issues and making sure that your basins and wash areas are cleansed. You've got the risk of spillage and slippage if you're carrying water bowls and etc. around. The time it takes, waterborne infections, and again, skin and damage, drain contamination from infections, and all these things that impact on skin health and skin integrity. So I've listed the references there, but I would encourage you also to have a look if you've got a real interest in dermatology. The British Association of Dermatologists is our national organisation. There's lots of guidelines and patient information there. The British Dermatological Nursing Group is our professional group, and again, it's not expensive to join. It's about £20 a year, and you get a journal, regular webinars, and updates. But two websites that are very useful when you're looking at skin conditions are DermNet New Zealand, which has lots of all the skin conditions, and it takes you through the history, the clinical presentations, the management, everything. So it's got lots of images which are really helpful when you're trying to talk to patients or they're trying to explain to you how their skin is. It's really useful for patients. And then the Primary Care Dermatology Society is our UK network for GPs and people working in primary care. And again, that has clinical pictures and guidelines and areas of practice and, guidance around treatment. So do have a look at those. There's some good resources there. So thank you very much for listening, and I hope to have some useful questions at the end.